Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Genital tuberculosis. Genital tuberculosis is a secondary infection. The most common site of genital tuberculosis is lungs. Lungs and lymph nodes, these undergo hematogen. The infection from the lungs and lymph nodes goes through hematogenous spread to the fallopian tube. Fallopian tube is the most common site, and the most common site in the fallopian tube is ampulla, and the least common site of genital tuberculosis in the fallopian tube is in the intramural part. Most common symptoms of genital tuberculosis is infertility, whereas second most common symptom of genital tuberculosis is most common symptom of genital tuberculosis is infertility. First most common site is fallopian tube, whereas second most common site is endometrium. Most common route of spread is most common route of spread of endometrial tuberculosis is direct spread from the fallopian tube, whereas least common site of genital tuberculosis is vagina and vulva. In genital tuberculosis, hysterosalpingography is contraindicated. But if hysterosalpingography is done, the following features will be seen. There will be beaded appearance of the tube or beads on string appearance is seen. There is lead pipe appearance of the tube or pipe stem appearance of the tube is seen. There is tobacco pouch appearance of the tube, and gulf stick or gulf club appearance of the tube is seen. There can be bilateral corneal block, and endometrium shows honeycomb appearance leading to Asherman syndrome, or there can be moth-eaten appearance can be seen in the patient.
Now, there is one little confusion. Most common route of genital tuberculosis is hematogenous spread. Most common route of genital tuberculosis is hematogenous spread. Most common route of endometrial tuberculosis from spinal cord, from fallopian tube. From fallopian tube, the spread to endometrium occurs by direct spread from the endometrium, whereas least common site is obviously vagina and vulva. So these are the different sites, and there is also moth-eaten appearance of tuberculosis.
Moth-eaten appearance of the fallopian tube is seen. Bilateral corneal block is a physiological spasm of the tube, and it is the most common pathology seen in genital tuberculosis. That is, most common pathological cause of bilateral corneal block on hysterosalpingography is genital tuberculosis, and the most common cause of bilateral corneal block on hysterosalpingography is physiological spasm. This blockade of the tube can be either in the cornea, which is called as corneal end of the tube, in the tuberculosis. If the blockade is in the corneal end of the tube, then it is genital tuberculosis. If the blockade is in the fimbrial end of the tube, it is gonorrhea.
Blockade at the corneal end is genital tuberculosis. Blockade in the fimbria is gonorrhea.
thank you and thank you for watching.